Good day, everyone. My name is Lena Lopez, and I want to welcome everyone to this webinar. You are attending the launch of a new CSA standard focused on work disability management in the paramedic service organizations. So today's webinar, the main focus is to introduce the new standard for managing work disability in paramedic service organization. And the next hour will look like the following. We're going to have opening remarks by Pierre Portier, going to speak to the CSA standard development process, provide background and rationale for the new standard, and for research behind the standard, and then provide an overview of the standard and its annex. So I would like to introduce the first two speakers. Dr. Amin Yazdani is the Executive Director of the Canadian Institute for Safety, Wellness and Performance School of Business at Conestoga College, and Dr. Emil Tompa, the Director of the Center for Research on Work Disability Policy. And to introduce opening remarks, I am going to introduce Pierre Portier. He's the chief of the Ottawa Paramedic Service. Pierre, over to you.
Lena, I think Pierre is still joining. We can.
Oh, actually, I'm sorry. I'm online. I just I thought I could. It says I can't start my video, but if you don't want to see me, that's okay too. Good afternoon, everyone. It's Pierre Portier. And thanks, Lena, for the intro, and excited to be here and kind of excited about this project, getting kind of the perspective and kind of the advocacy that it needs to kind of get the word out about the good work that's taken place over the last year and a half, 2 years. So in terms of the introduction, I'd just like to kind of frame this. That several years ago, and I'll keep the story short. In 2011, there was a project by the CSA which involved numerous stakeholders, which was psychological health and safety in the workplace, and I think that was Z1011. And following that, a few years later, the paramedic community was able to access funding in Ontario and create the specific psychological health and safety in the paramedic service organization, which built upon that first standard. So these two standards really kind of set the groundwork for future work. And this is one piece of that future work that really is kind of this holistic perspective that we have to take a look at the work environment from a physical point of view and also from a mental point of view. And what are the things that we can do to improve the work environment such that people keep coming to work, that they're healthy, that they're safe. And the work disability, I think, is an important piece of this, is that we recognize that, and I think there's lots of research, and I'm not the expert on it, that people that are happier seem to be more productive, and that bringing people back to work is often the best way for them to rehabilitate. And I think I'll let other people speak about the detail regarding that. The process that we've engaged in, and I won't go too far into it, is really something that is very much stakeholder-led. And kudos to Lena and the CSA as kind of this organization that really has a robust process that leads to good results. So thank you, Lena. And then also thanks to Amin and Emil for really kind of shepherding the process and the back and forth and the discussion pieces that take place. And really the dialogue, the discourse that leads to good decisions and leads really to the quality of this product that you're going to see today. So Thank you, Min. Thank you, Emil, and thank you, Helena. Really impressive. And the reason I give thanks is that I think the paramedic community, we're learning. You know, we're still a young profession. You know, if you go back, if it's the Korean War or the Vietnam War or the starting points, we don't have 100 or 200 years of history. Really, our history is very short, and bit by bit, we're really putting the pieces together to recognize where there's need and filling those gaps with important pieces of work, such as what's being presented to you today. So thank you, Lena, and I'll turn it back to you.
Thank you, Pierre. To start off, I want to provide acknowledgements. The research and development project was made possible in part by the financial support of the Canadian Safety and Security Program, managed through the Defence Research and Development Canada, the Centre for Security Science, also known as DRDC, CSS. In addition, there have been 5 critical project partners that I just want to acknowledge, as mentioned to earlier, and that is the Canadian Institute of Safety, Wellness and Performance at Conestoga Business School of Business. CSA has also played an involvement facilitating the standards process, and in CRWDP, as well as Paramedic Association of Canada, as well as the, make sure I get this acronym properly, also known as PAC, which is the Paramedic Chief, and I might have just missed that one there. I'm going to start that one over. The Paramedic Chiefs of Canada, as well as the County of Renfrew Paramedic Service. I'm going to provide a quick overview on the standards development and how this standard came together. So next slide. I'm going to provide you with what's covered here on the screen. This is the 5 W's and then how we got here. So next slide. So at CSA, CSA, the organization, is a non-governmental organization, and it consists of 2 parts. So the one area is the commercial area that's well known through the testing, inspection, certification. And the other side of CSA is the standards development organization. And that's the area that we're going to focus on today. Within that standards development organization, there are approximately 13 distinct sectors. I'm focusing specifically on occupational health and safety and public safety. Next slide. And next slide. So what's presented on the screen is a cycle that every standard goes through from the beginning until the document is published. And so right now the standard is Z1011.1. We are now at the publication process, and now the committee that worked on it is in maintenance mode. So it's a much quieter period, and that holds for approximately 5 years. And then that's where the committee will receive input from the public and look at requests for change to start building a case to develop a new edition. Next slide. Here on the screen, just listed 4 standards. These are the most recent standards that are focused on the paramedic community, and that also relates specifically to the paramedic community. There's the top one that's highlighted on my screen. It appears, I guess, a burnt yellow, amber sort, and that's the standard Work Disability Management and Paramedic Service Organization. But out of interest, there was a standard that was published, seen here, last year, and that's one below it. And then currently there are 2 that are in queue to be published later on next year, and that's the First Responder Fatigue Risk Management System. Of course, these standards can publish in advance of that time frame, and one that's currently in draft. So there is a committee that's currently working on the standard, and that's the National Occupation Standard for Paramedics. And I indicate draft because there's always an opportunity to join that committee in different in certain insertion points, and I can speak to that a little bit later. On this screen, there's 7 standards that have been published. We can just go to the next screen. So with each committee, it consists of members, of course, and then this specific standard consists of, let me see here, there are 5 different categories. And what is trying to be achieved is to ensure that there is a balanced representation from different areas to help inform the content that goes into the standard. So this specific standard, it had individuals from a general interest, so that's from academia and interest groups, and then in government and regulatory authority. Then we have individuals from organizations, from paramedic service organization, professional services, a lot of doctors in the area of psychological health and safety. So we have the psychologists in that category, and then user interest, the paramedics and the workers. You can go to the next slide. The question we often get asked at CSA, well, you know, is do we have to do the standard? Do we have to adopt it? Now, the question is always, it is available, it's a volunteer standard until it gets referenced in legislation, then it becomes mandated. But a lot of times the government will move and work closely with CSA to move forward work that's been done through a standard that's voluntary, and it will move it forward into legislation. And then at that point, through the regulatory bodies, they decide on what gets adopted and put into regulation. Next slide. So just how to get involved in it, and really important. What I view as important, an opportunity for you to get involved is that if you're listening onto this webinar and interested and haven't been involved, you can participate on the CSA community, and that is just a very watch the activity that takes place. You can go specifically into the interest of paramedic. Currently, we're working on a paramedic community. So if that is of interest to you, just please provide my email. You can reach out to me afterwards. At each point as well, standard goes through that process, that cycle that was highlighted earlier. It does go out to public review, and that's where we want to hear from external stakeholders, and we want your opinion on what has been drafted. And that's your opportunity to weigh in on what will be published later on, as well as if there's an area of research that you're interested. We do have that academic and research arm. And there is a link there or a URL that you can copy to join and to connect to the CSA community. And of course, that's complimentary. And on the screen, you'll have my email. So it's lena.lopez@csagroup.org. Next slide. So the next slide looks at research behind the standard. I'll hand it over to the next speaker.
Thank you, Lena and Pierre, for the introduction. My name is Amin Yazvani. I'm the Executive Director at Canadian Institute for Safety, Wellness, Performance, housed within Economics College's School of Business. With the next few slides, I'll be speaking to the research that led to development of this standard. The research was conducted in collaboration with Center for Research on Work Disability Policy, which is led by Dr. Emil Tampa, who will be speaking as well today. To give you kind of a background about what challenges that paramedics face in Canada, well, there are about 40,000 paramedics in Canada that they provide very important and crucial public safety service to Canadians. There are frontline heroes, and I think we all agree that their work and the impact they had during COVID-19 pandemic has been tremendous, and would like to thank every single of them for their effort in keeping us safe. So what is our responsibilities and what have we done to make sure that these individuals are safe and they're protected? Paramedics provide out-of-hospital emergency medical care, and despite the attending these medical care, it can be usually stimulating and manageable. Others can be frustrating and non-urgent, or could be even strenuous and distressing, which could expose paramedics to a range of physical and mental health issues. Other inherent characteristics of the work that is often cause a lot of issues for paramedics involves long hours and shift work and long drives and being on call. And often, many of paramedics across Canada, many of the paramedic service organizations across the country, they have capacity issues to keep up with the demand that exists and is increasing as again, we're having an aging society. So their roles become so important in our day-to-day life that we want to make sure that they're safe and protected and they can kind of maintain that level of capacity to be able to provide their service to the public. In terms of the occupational stressors and risk factors, we're looking at a range of issues and range of stressors that could impact the health and well-being of paramedics, including physically demanding tasks around transferring patients, lifting, carrying patients on stretchers, staircases, or backboards, prolonged sedentary time to sudden high physical demands that could lead to significant amounts of stress and the physical body. Body motions that are most source of physical injuries, about 90% attributed to lifting, carrying, or transferring a patient or equipment. And for that side of things, we tried to address some of these risk factors through the development of CSA Standard on ambulance design. And we utilize prevention through design approach to be able to address the physical injury aspect of the task by improving the design of ambulances. On the other side, paramedics are exposed to potentially psychologically traumatic events and other occupational stressors, including operational stressors and organizational stressors that could impact their mental and physical well-being. Those may include fatigue from shift work or overtime, lack of sleep, physical fatigue, cognitive fatigue, staffing shortages, inconsistent leadership styles at the organizational level, lack of resources, and so on. There were multiple studies conducted at the national level looking at the physical and mental health status of paramedics across the country. There are a number of injuries, there are a number of mental health outcomes that have been highlighted in the literature that could lead to reduced capacity, to increased costs to paramedic service organizations, and consequently reduced capacity of organizations in addressing the needs of their communities. And these impacts, these injuries, they not only affect the individual, but their friends, their families, their coworkers, and as I said earlier, communities that they serve. Through the research development, we recognize that among other things, operational stress injuries is a significant problem among paramedics. And this table, for example, you can see that almost half of paramedics in Canada are screened positive for at least one mental health related outcome. So what is OSI? What is operational stress injuries? Well, in the CSA document, we defined OSI as a broad range of conditions, including diagnosable mental health disorders, such as anxiety disorders, depressive disorders, and PTSD, as well as non-clinical conditions that interfere with daily functioning. And so it's not so OSI, and we're categorizing mental health condition as injuries. We're kind of adding that similar legitimacy to these outcomes as physical injuries, as the term can decrease also a stigma associated with the language, such as mental disorders or mental health conditions. So they're not diagnosable mental health disorders, but they also may be used to refer to one or more type of mental health outcomes. And these injuries can be caused by work-related and non-work-related exposures. In terms of the economic burden of mental health, there are a lot of stuff out there, but we should keep in mind that the mental health outcomes is a broader issue across Canada. So it's not specific to paramedics, it's not specific to any occupations, but is a significant issue which COVID-19 also perhaps accelerated some of these outcomes in many communities, in many countries. This graph is based on pre-COVID data, and as you see, we should expect significant increase for total cost of mental illness in Canada. And the role of organizations, therefore, in supporting their workforce is significant. But then, you know, they need resources. They need to know what to do. They need frameworks that could help them to establish an organizational-wide strategy to address mental health outcomes. As I said, over the past few years, and Pierre spoke to this issues that paramedics face and the standards that were developed through CSA, there are a lot of organizational resources that they were developed to support paramedic service organizations in reducing workplace injuries and disabilities. I mentioned the example on the ergonomic design for ambulances, which again utilizes prevention through design approach to address physical injuries. But then there's also what we will be launching today is the Work Disability Management Paramedic Service Organization, which the objective focuses on providing requirements and guidance on how to effectively manage the health needs of workers in the paramedic service organizations, and looks into utilizing a kind of an approach, an organizational approach, and focus on prevention management of work disability related to operational stress injuries and other mental health and well-being conditions. But what we try to do with this standard, and the standard and the framework within it could potentially be used to address work disability management for physical injuries as well. So how we came up with this, again, we kind of utilized three approaches to better understand key informants we use on kind of organizational practices to address OSI, as well as the barriers and facilitators. Through an environmental scan, we're looking to identify recommended organizational programs and practices for the prevention and management of PTSI in paramedic service organizations. And also a scoping review looking at the extent that the scientific literature has covered the topic on kind of stressors and mitigate strategies. And the first study, which again, the results is available through our website, and the research report is available to our website. We looked into key informants perspectives on the existing and desired organizational-wide initiatives. And again, we're focusing on organizational-wide strategies that will support organizations, paramedic service organizations, in prevention, detection, and interventions related to OSI and PTSI. And again, we interviewed paramedics across Canada, and we wanted to kind of be comprehensive and better understand kind of labor and management perspective on these issues. Some of the key findings, well, while organizational-wide initiatives were in place for the primary prevention, early detection, and intervention disability management of OSIs, systematic challenges with coordination, resources, and worker engagement were also identified. So these challenges that were highlighted prevented paramedic service organizations from optimally addressing OSIs in their workplace, and integrating considerations from the elements identified within this interview into a broader existing management system, where it seems to be a way that we can actually overcome some of these challenges. So we identified several barriers that we try to address them to the standard. We also did an environmental scan that we looked into identifying any recommended organizational programs and practices that will be possibly available for prevention and management of PTSI or OSIs in the paramedic service organizations. We obtained sources through a web-based search and snowballing techniques, through interviews, through stakeholder engagement. And we also looked into any resources that might be available internationally that would be specific to paramedics, to first responders. And also we consulted with knowledge experts in work disability management for additional resources and to ensure that, again, we're not missing any vital resources. And then they identified some policies and recommendations out there that could potentially be helpful. And we brought in all these resources to technical committee. We had extensive consultation with a lot of stakeholders to go into identifying best and evidence-informed resources that will highlight some of the organizational strategies that will be required within this standard. Again, resources around stigma reduction. There were some discussions around pre-employment screening. There were some resources around stress leave, peer support, employment and family assistance programs, best practices around mental health referral networking, and so on. A lot of stuff around disability management, return to work accommodation. So we tried to learn from those resources, try to integrate as many as possible that they actually had evidence to back them. So then ensuring that the standards as evidence so far. We also kind of led by research Center for Research on Work Disability Policy in ML Tampa. It was a scoping review that was conducted, which Emil will talk about in a moment. And all of these research, all the partners have effectively collaborated and participated in all aspects of the research. So I just want to hand it over to Emil, and Emil can speak to the study that he led around the scoping review of the literature. Emil?
Okay, thank you. Can you all hear me okay?
Yes.
Okay, so yeah, I'll just briefly touch on this literature review. It's quite an extensive piece of work that both Amin, myself, and a number of other colleagues were working on over a year-long time period. It's an international scoping review, and what a scoping review is a very structured approach to synthesizing the evidence in the peer-reviewed literature. And the objective of this scoping review was to identify and synthesize peer-reviewed evidence on programs and practices for the prevention and management of OSI and other mental health issues that are relevant for paramedic organizations. And I have a bit of the methods listed here where we went through a structured search across several databases. Actually, these were electronic journal databases. We looked at over a 10-year time period from January 2010 to January 2020. And we actually have since updated this search as well. So we brought in some incremental literature. But we have listed here the databases that we looked at. They may not be familiar to everybody, but these are the journal databases we identified some key articles in. So we found them to be a good resource on this topic of OSI and mental health management in paramedic and first responder organizations. So we looked at Medline, Embase, PsycInfo, and Business Source Premier. And through our keyword search over that, can you go just back again? Sorry. Okay, so that keyword search, we had identified original titles and abstract search identified almost 5,000 citations and abstracts that we distilled down to 40 articles that we included in our synthesis. And that's what I'll tell you about the methodology, but the full report, which is available at that link that you see on the bottom of the website, will give you much more details on both the methodology, but also the details of what we found in this literature. And it's going to eventually be a peer-reviewed journal. We're just submitting it currently to a journal for peer review, but the full report is available on the CRWDP website. Next slide, Simon. Okay, so of those 40 articles that we identified, we grouped the evidence that was available in them into 5 clusters. And I'll just describe them briefly here. So one of the clusters was about the roles and responsibilities of different actors in the workplace. The second cluster was about access to health services as being an important element of disability prevention and management. Another cluster was about primary prevention being an important upfront piece, that particularly thinking about resilience training in the case of paramedics and paramedic organizations. Another cluster was around early detection and interventions. And the last cluster, the 5th one, was management of PTSI and other mental health conditions. Or actually, I should be saying OSI. That's the term we're using currently for this standard. So these are the 5 clusters that we identified and synthesized the evidence around from these 40 articles. There was also several key themes that emerged from the literature, and I have them listed here. So managing training in mental health and manager confidence was suggested as being an important element of reducing sickness absences and the time on sickness absence. Improving organizational culture and reducing stigma really can lower the barriers to help-seeking behavior of paramedics who may be affected by stress and mental health issues. Another key theme was about building resilience as an important factor for the primary prevention of OSI and mental health. Another theme was about peer support and the importance of peer support programs that were important to the early detection and intervention when mental health conditions arise. And then the last theme was about early and frequent contact with managers once a worker has begun an episode of sickness absence. And this was found to reduce time away from work and help expedite the full return to work and regular duties. I'm going to drill down on only one of the clusters just for the lack of time, and that cluster is about roles and responsibilities, and particularly the role of managers and supervisors. So there was a couple of programs that were extensively discussed and reviewed, in some cases, and evaluated in this literature. The first one is called RESPECT, and the other one is called TRIMMED. And so the RESPECT program for managers mental health training program combines mental health knowledge and communications training to improve manager confidence in helping deal with worker mental health needs. And then the trauma risk management, or the TRIM program, is a peer support trauma risk management program, which requires careful selection of TRIM practitioners, strong support for the program by junior, mid-level, and senior managers. And that's actually a theme that really we saw a lot of, the importance of management buying into these programs and supporting them in a big way, because it can only be successful if there's buy-in across the organization. I'll just mention really briefly a couple of other interesting programs that we came across in this literature. Which was, one of them was on the prevention side, which was called Stress Resilience Training System, or SRTS, which is a self-regulated and resilience building program that's delivered virtually, actually, often through, if we had an iPad or a computer kind of thing, so it could be self-administered. And then another one was called Chaos-Driven Situation Management Retrieval System, or CHARLIE, which is a technology-based adaptive learning and prevention program for stress responses. So there was lots of rich material in this literature across the 40 articles. And since our update of the review, we have quite a number of other articles we've added to the synthesis as well. So I really encourage people who want to learn more about the various programs that have been implemented around the world and evaluated in many cases to turn to that report that we have that link for on the earlier page. And also eventually we'll be, as I said, putting that out into the broader literature and the peer review literature for broader consumption. And I'll leave it at that. Thank you.
Thank you, Emil. And if you're interested about any of these resources, please feel free to contact myself or Emil, or visit CRWDP or on CSWDP website. In the next couple slides, or 2 or 3 slides, I'll go through some of the features of this standard that kind of might be an important aspect of this standard. Similar to any CSA standards, the standard starts with the administrative information, summary of changes from previous editions, history of or rationale of the standard, as well as guide on kind of using of this standard, purpose of this standard, and what is covered, and what is not covered through this standard. And then they're kind of reference publications, definitions, and then so on. What we did with CSA Standard for disability management and paramedic service organizations, we've kind of utilized that famous PDCA model, which is consistent to other management system standards for paramedics. So if an organization implements one of these standards, they do not need to reinvent the wheel. They can actually utilize the same framework and be able to implement work disability management system standard as well. So that there is that harmonization, there is that integration that could potentially create an opportunity for utilizing existing resources to implement this standard. I talked about the standard and the scope of this standard. Again, the standard includes specific requirement guidance related to management of work disability associated with OSIs and other mental health conditions. And it could be due to, and these conditions, it could be due to work-related and non-work-related exposures. And also the framework is general that could be applied to any type of disability. In the clause 4 of this standard, we have identified the rules and responsibilities of several stakeholders in the process and defined what needs to be committed by the leadership of paramedic service organizations, and of course, with active engagement of paramedics and their representatives, including labor unions. We don't want PSOs or paramedic service organizations to reinvent the wheel. So they might already have kind of good practices in place that is more or less aligned with the requirements of the standard. So we have requirement in this standard that wants paramedic service organizations to look into their internal practices and even go beyond and see what practices are available through their own channels with external stakeholders. Then do a gap analysis. And for that, we supplied an annex that will help paramedic service organizations to identify the gaps and establish objectives and targets and plan to make change. And all of those are based on this framework that is outlined within this standard. Of course, we have several requirements to consider resources and other restrictions, which may vary based on paramedic service organization size and function. Following planning, we go to implementation phase, in which several requirements are outlined to ensure competent individuals within organizations lead the change. We have requirements around measures to address OSI, stigma reduction, mental health promotion, best practices for self-care and wellness checks, post-incident interventions, and of course, accommodation and return to work. We have also several other requirements around confidentiality and competency and training. And similar to any standard level organizations, we have clauses and requirements for performance monitoring, evaluation, and continuous improvement to make sure that the standard is scalable to the size of PSOs and its work disability management system. And again, identify some qualitative and quantitative measures that could help paramedic service organizations to measure their performance. The whole process is very dynamic, and again, learning from the outcomes is to be continuous. In addition to those requirements, there are several annexes to support implementation, including wellness checks during a medical leave, a guide to do that, a guide around mental health literacy, training and education, a guide on worker-focused exposure program, and again, the rest of potential references and resources. So that was kind of a very quick overview of the standard. The standard is available through CSA website, but if you're interested, Lena, I can supply you with a link to that standard to be for download. But I would like to hand it over to Lena at this point to introduce our panelists. And panelists will be kind of sharing their thoughts and perspectives on some of the questions that are presented to them. Thank you. Lena?
Thank you very much. I'm in next screen. And before I introduce the panel members, I just want to remind all of the listeners, there is a Q&A button at the bottom of your screen. You're welcome to submit a question for a panelist or for any of the earlier speakers. So to start off with the panel, panelists, we have Bindin Norowski-Kia, who's one of the panelists. So is Kevin Georgievic, if I got that wrong, please correct me, and Matthew Grenier. So there's 3 questions here for Matthew. Matthew, let me know if you'd like me to read out the questions or if you'd like to start.
I can start. Thank you, Nina. So my title is not the Ontario occupational nurse. I'm a deputy chief for the County of Renfrew, in charge of quality program. So I just want to start with the key challenge from paramedic service organization. And I'll try to be short because I have three people on the panel and I don't want to take too much of the time, but I think one thing that we've seen in the last 2 years is the resiliency of our workers seem to be far more vulnerable than they used to be. Like with the worldwide pandemic, they have amplified the typical work pressure. Like just an example, in the hospital, they have a huge gap in the EHR. So we have a gap in physicians and nurses that increase their offload delay, that increase the workload that the paramedic need to do on the road. And also paramedic on the ward need to be hyper-vigilant. Every day they do a call, they need to wear their protective equipment. They need to make sure that they protect themselves, their partner and their family. So I think this standard in my mind is not just good, but is critical to keep paramedic services organization running in the future. So what I learned through the process is that mental health and resiliency is not determined only by workplace factor, but each individual bring baggage with them from the personal and professional life, from their education, from their sports structure, and from their personality. And I think one gap in our system is the lack of screening, either at the college level or at the hiring process in the service perspective, to ensure that our paramedics are well equipped to manage the reality of our job. The violence that we see, the death, the human suffering that paramedics see most day. As a paramedic services, we need to raise the bar and to ensure that our paramedics have the tool to strive in this profession. And the last point in terms of the first question is, from a service perspective, I think the stigmatization of the operational stress injury is still there. It has improved in the last couple of years, but it's still quite present, and we still need to keep an eye on it and make sure that we create more awareness. From the second question, I think the new standard will help organization to bring a somewhat of standard across the country. The help paramedic services organization to be consistent, to be structured. This framework has everything in it to build competency, key performance indicator, some quality improvement processes. I think this is really a great structure, and I think that can bring our service forward for sure. The standard has also enough concrete information to connect clearly to your paramedic staff, our direction of first and future commitment regarding the work disability management program. This will not happen overnight. I think this is a standard that if everything bring a good change management process, and eventually that will bring a change in culture in the organization. The last piece in terms of the faceted standard that was personally helpful for me, this is a tough question because I think he has so much good clause and point in that standard, but I brought a couple for you guys. In terms of the gap analysis, I think this is the first process that most services need to do, is say, okay, where are we at in terms of our service and where we need to work on. And it's really well laid out in terms of the question and the structure of the process that you can really do a gap analysis fairly quickly. And after that, you get the planning, the monitoring, and the continuous improvement quality. And same thing, they walk you through in terms of which question you need to ask and which data then you need to capture to make sure that you can improve your service from A to Z. And the second then the second section of it is all the education and the belt of competency. Because I think, creating some awareness at all level of your organization is key. And I think if we need to indicate and create a culture of change to make sure that we have a peer support in place, to do early intervention and prevention to move our paramedic services forward. Thank you, Amin.
Thank you, Matthew. And over to you, Kevin.
Hi there, I'm Kevin Jerbick with Alberta Health Services EMS Employee Programs. Been in this role for about 8 years now, and it's been a pleasure to work on this CSA Standard and definitely getting to know and discuss with stakeholders from across the country. Just to build off of what Pierre mentioned at the beginning, I think that one of the challenges that paramedic services across the country have are we tend to be bound by certain policies, and every organization, depending on how they're structured, has a lot of different areas and departments, and very quickly they can become siloed. And silos are there, partially for a reason, but I think those silos too start to create some of the difficulties when you're looking at, a holistic approach of a staff member that, has gone off work and is trying to come back through that system. So this standard really forces organizations to look at their policies and ideally, hopefully, to have them start to question who their customer is, right? It's the staff member that's coming back to work. Oftentimes we've got policies that are there to protect the organization, and rightfully, they need to be there. But again, this is just forcing different organizations to really take a look at what the actual goal is. Do we want something on paper that looks good? Or do we want to start knocking down some of these silos and having people work collaboratively to support the staff member from the beginning of their journey all the way through to that coming back to work or transitioning to whatever their new normal is? And I think that kind of tied number 1 and 2 together. Some of the lessons learned for our organization certainly was that when you do start to look at that holistic approach and setting up different areas within your organization to advocate for staff members, while still following the policies that are in place. The pandemic was mentioned, right? And all of the additional stressors that came with that, additional staff going off, staff shortage and things like that. In some ways, it's been a positive in our organization. And what I mean by that is people are busy, right? So this forced where there were prior, silos, for people to work more collaboratively, and we've been able to look back and say, wow, like we can actually do this, and where have we started and where are we now? Some of the facets that I found particularly helpful, again, it's that holistic approach for it. For myself, I'm quite invested in one of the annexes, an Annex C, which was the work-focused exposure program. In our service, we call that the reintegration program, and we did our first reintegration session back in 2015. And if you get a chance to look at that, and if anybody has any questions, certainly reach out for additional detail. But for our organization, we put a lot of focus on that piece. Because really it's that transition, it's that bridge from the clinical setting to how do we get somebody back into the workplace in a safe manner where they're healthy and when they're ready for it as well. So I think that's one piece where I found it particularly helpful to have in there to give just some more validity to the work that that we've been doing. That we're seeing a lot more services reach out and starting their own work-focused exposure programs as well.
Thank you very much. So now the next panelist has been
Sure. Okay, thanks very much. And I'm cognizant of the time, so I'll try to be expeditious, but also cover this from perhaps a different lens and a different perspective. So my name is Betty Norzakia. I'm an occupational therapist, and also I'm an assistant professor at the University of Toronto. So for me, from a clinical perspective, I've worked with first responders, including paramedics. And I go back to the OSI definition to really frame my thinking on this, which is around functioning. And functioning when you want to support people, particularly in the workplace, because at the end of the day, what we're really looking at is, are people able to do the things that they need to, want to at work and beyond work, right? So from that perspective, for me, this standard provides a lot of opportunities for us to look at this more carefully through a holistic lens, a biopsychosocial lens, and it gives us really a blueprint or a guideline to frame the discussion. It's no longer, people working in silos in different parts of the country, but rather a unified approach that looks at providing evidence-based, data-driven approaches that are strategic and deliberate in supporting engagement for paramedics, whether it's when you want to onboard them, support them at work, or return them to work. And the other perspective that I'll add that I really like about the standard is the focus that it has on being client-centered or worker-centric and allowing us to have that individual perspective recognized. It's no longer good enough to just say that there's a one-size model that fits for everybody, but rather one where people can deliberately look at things through a model where you recognize the subtleties, the differences, but also with a focus on functioning. So that's what I would suggest might work. And finally, I think, moving forward, I think it really gives us an opportunity for academics like me and others that are interested in studying this a little bit more carefully through a research perspective to get together and to put our collaborative efforts into research that will really improve, ultimately, at the end of the day, the well-being of paramedics in the workplace, whether it's through a physical lens or through a mental health perspective. Maybe I'll just stop there just so that there's an opportunity for questions as well.
Thank you very much. So just moving into the Q&A, just a reminder that you can submit your questions through the Q&A button found on your screen. There are two questions that have come through. First one is directed to all the panelists and speakers. The first one is, can the standard be used to address work stability related to physical or sleep-related fatigue? Was a question for the speakers or the panelists?
I didn't hear the questions.
No problem. No, not a problem. I'll repeat it. Can the standard be used to address work disability related to physical or sleep-related fatigue?
Yeah, I can speak to that, Lena. Although we do have currently a standard under development. It's called fatigue risk management system for first responders. But then I think with respect to the disability outcome related to physical or sleep-related fatigue, of course, the standard has been designed in a way that allows organizations to implement a organization-wide work disability program that addresses the workforce needs, and regardless of the reasons of disability. Again, we do have a lot of focus on OSIs, but then the framework is general enough that could be applied to any type of disabilities. Thank you.
Thank you.
I mean, if I can just add, I'm working with on the other standard who's going to I think, come up sooner than later, and it go really in depth in terms of, you know, the same type of process for this sort of standard. So I think if you're looking at to dive a little bit deeper, that second standard will be able to answer all your questions.
Thank you. There's a question that's come in. The question's the following. Will provincial health and safety bodies be looking to implement a review of organizations and if they are following the standard appropriately? There's a second part to this question. Will there be reviews, recommendations to organizations if they are not in line with the standard?
Maybe I can start this, and then maybe if Pierre is on the call, or Kevin or Matthew can speak to that. I think the standard is not yet referenced in legislation. I think in terms of the health and safety bodies in terms of the government, I think if I'm not mistaken, about 50% of CSA standards in general are referenced in legislation. But this standard is brand new standard. It has not yet been adopted or been considered by the government to be partially or fully referenced in legislation. So in that regards, I'm not quite sure if there would be any enforcement around this, but I'll kind of hand it over to Pierre to speak to that as well.
Yeah, thanks, Amin. Good question. There's a kind of a long history here, and I'll keep the story really short. In the States, there's a standards group, and many of you may be familiar. It's called a National Fire Protection Association, and it's created numerous standards. And over the years, as standards become more and more respected, we'll say, they do at times get written into legislation and then become the reference point. And in Canada, that's what we're trying to achieve through our relationship, the paramedic community, with the Canadian Standards Association, or CSA group, is that as we develop standards, that as we get the word out, that people start to adopt them on a as-needed basis or on a voluntary basis, that eventually over time they may become written into legislation. So the quick answer right now is no, they are not required. They're not. It's not prescriptive in terms of nobody has to follow it. It is all permissive. But in years to come, and I don't know that timeline, that hopefully some standards, and this may be one of them, actually does get written into legislation. So that really is our perspective on this issue. And it's, you know, there's a long game here, that the great work that's being undertaken by various standards collaborations eventually hopefully do end up in legislation to the benefit of either the community or to the practitioner. Thank you.
Thank you very much, Pierre. And Amin, I'm going to hand it over to you. It is now 1 p.m. in Toronto.
Thank you so much. If I'm not muted. Thanks again for attending today's webinar. This is one of 4 webinars that will be looking into providing resources for organizations in terms of understanding what are the scope of the standard, as well as providing some sort of a overview on different aspects of this standard with keynote speakers as well as panelists. The next webinar is scheduled for June 20th will be led by CRWDP. The time might change for that one. I'm not quite sure. So if you're interested about that, please contact Dr. Tampa. The webinar number 3 is going to be in September 19. It will be managed by CSWP, and we're focusing on managing disabilities associated with operational stress injuries. And last webinar will be on October 17, which will be managed and led by CRWDP. All of the webinar recordings will be available through our YouTube channel, as well as CPW or website and media channels. And if you have any questions about the standard, about the research behind the standard, please feel free to contact myself, Lena, or Dr. Tampa. At the end, I would like to thank everyone for taking the time for participating in this webinar, and also our panelists for taking the time and being able to share their perspectives with our audience today. And we hope to see you in our future webinars. Thank you.